Well, greetings, everyone. I'm Bruce Frankel, president of the Life Planning Network. Thank you for joining us today for our conversation with Bridget Bohannon, director of Sarah Lawrence College's MA in Health Advocacy program. Bridget has 15 years of experience in program design, implementation, and evaluation of sexual and reproductive health nonprofits. She received her BA from Villanova University and her MPH at UCLA. She is Sarah Lawrence's director of the Masters in Health Advocacy and provides students with deep multidisciplinary understanding of the complexities shaping the healthcare system in the US and the tools to make positive change on behalf of individuals and communities. So welcome, Bridget. We're really grateful for you doing this and taking the time. And I just wondered if you would maybe start off by telling the story of how you ended up doing health advocacy, and then we'll get to some of the questions.
Absolutely. And thank you so much for extending the invitation to have me join you all. And thank you, Barbara, for that lovely moment. I needed it. So thank you. So I sort of took a circuitous route to get to where I am. I grew up in a family that did a lot of caring for elders at home, allowing people to age in place and ultimately, die in their homes when that was possible. And so always was around sort of caregiving and had that ethos as part of our family obligations. It was, we took care of the people that came before us or the ones that fell sick along the road. And then when I got to college, I went to Villanova University, as you said. My degree is in sociology, and I took the majority of my courses in the Peace and Justice Center at that school, and so really became deeply invested in social justice and the systems that either work in aid of achieving social justice or more often that work in opposition to that goal. And so graduated college not knowing at all what I wanted to do with that. I had a plan that looked very different than the one I am living. And so wanted to take a little bit of time before going on to graduate school and ended up getting a entry-level position at a nonprofit that worked with medical students. And that really shifted both how I saw myself in the world and what my career goals were. So in this organization, we worked to organize communities of medical students on campuses. By the time I left, we were in 32 countries that wanted to change their curriculum to be more inclusive of sexual and reproductive health topics, but also to start thinking about how and why medical students are taught the way that medical students are taught. I reference this study all of the time. It came out of Jefferson University, where they measured empathy in medical students. And so when a medical student enters their training, they are off the charts idealistic. They want to save people. They want to help their communities. They're, in it to make a difference. And then by the time they graduate medical school, their empathy has bottomed out. It is lower than like any other professional graduate school. And part of that is by design. And so, and then you go to residency where I left medical students for a while. I did union organizing for resident physicians at LA County hospitals. And their training is so grueling that it is just, it really strips the humanity out of the system. Not only are people that are in that system not able to show up as their full selves, but it becomes just a system that is churning to, chart people, get them out the door, hopefully provide care that alleviates pain or, certainly save lives, but the system started maintaining the system. And so and this is a long ramble, so I apologize, but my approach to health advocacy has always been in that macro sense. How can we change something, whether it be, a small language change on an intake form to payer systems that not only improves the healthcare experience of the people providing care, but more importantly, how do we improve health outcomes? And then so I came to Sarah Lawrence in 2022 because the pandemic just opened up fissures in this system for everyone to see. They existed before the pandemic exacerbated everything, right? And so really felt it necessary to revitalize a health advocacy program to put more people out into the world that can help patients navigate a system that is fractured at best, help people get access to a healthcare system that's been designed to exclude them, and how to make that system a more humane and sustainable practice. And so that's where I'm at now.
Well, thank you for that introduction to yourself and your journey into health advocacy. So maybe we could begin with you explaining what the primary role of a health advocate is and what a health advocate, what does being a health advocate really mean?
Yeah,
Personally,
absolutely.
professionally, and to the community.
So there's two key tracks to being a health advocate. One, like I said, is more macro. And so that would be perhaps looking at a community or community-wide issue and working to address that either at a hospital level or a legislative level or, a payer level. So an example of something that one of our alumni are working on is that thankfully, HIV medication has now made that a disease that many people can live long and healthy lives on. It is an expensive regimen of drugs, and people are now aging to retirement and beyond while being on this cocktail of drugs that they'll need to be on for the rest of their lives. Most private insurance covers those drugs, but once you get into Medicare and the supplementals, that becomes a different story. And so we know people that don't feel comfortable retiring because the cost of their HIV medication will be prohibitive to them being able to live their lives on a limited income. And so we have, an alumni working to figure out how best to educate people about their options around HIV medication, how to make sure that Medicare is clear on what is covered and not covered, and making any sort of bids for more coverage if need be. And so that would be an example of a macro health advocacy project. Most often, health advocates work on an individual level. And so that is helping a person navigate either a chronic illness or, an acute hospital visit that may entail follow-up care or involves some sort of care coordination. And there's a couple different routes that takes also. So there's a lot of branches to this. During one of the changes in the Affordable Care Act was that hospital reimbursements coming from CMS take more into consideration patient satisfaction. And so if you've ever been to an emergency room in the last 12 years, you may have, 12 years? Yeah, may have gotten a phone call afterwards for a quick patient satisfaction survey. Because there's money tied to that, a lot of hospitals started bringing patient advocates to work inside of that system. And that can be dealing with grievances, dealing with family members, making sure that patient education materials are effective. And it can also be, working with providers or staff or a certain department or system that seems to be a pain point for patients. And so addressing particular issues. Because of that change, private insurance companies have stopped covering patient advocates outside of the hospital in the way that they used to prior to that. But that is a large piece of what health advocates do. They are contracted with an individual to help navigate care, to be with a person if they choose to ask questions, to make sure that every physician in your care team is receiving the same information and is aware of the different procedures or interventions that different departments or specialties may have done. And then often it's to educate family members. So another alumni of our program runs a health advocacy group that works for people that do not have children or do not have children that live nearby. And so if there's a fall and you end up in an emergency room, she would come with you and then talk to whatever family members about next steps, and then, also do all that care coordination, getting a person into a rehab center or a SNF or whatever. So there's a lot. This is like the most depressing sentence I'll say during this call, but there is so much work to be done in accessing healthcare, that there's so much work for a health advocate to do. And that's why you'll see some people really digging down into specializing. They're only going to help people with a certain type of cancer, or they're going to help communities where English isn't the primary spoken language. There's a lot of room for specialization and a lot of areas for intervention because there's so much work that has to happen.
Yeah. Before I go to the next question, two quick things. One, when we first spoke, I loved something you said, which was that there's so much work to be done, that I had asked you why you don't get depressed doing this work. Mm-hmm. And you said there's so much work to do that that if just a little bit is done, it will help. That anywhere you do some health advocacy, it can benefit a person and the system.
Yes, yeah, so, that's absolutely right.
And just a quick question: when are people assigned health advocates now in hospitals, or do they have to request them?
You often have to request them, and that in itself is a systems failure, both that it's by request and that often information isn't given to a person that they can request a patient advocate. So that's something when you're working with clients, to just make everyone aware that they should ask for a patient advocate. It's also just helpful to have another person in the room with you if you feel comfortable, whether they're a health advocate or not, because I've certainly been in medical situations, not in a crisis situation, where I'm anxious about something or want to make sure that I say X, Y, and Z, and then I don't hear anything else that the person has said except the answer to that particular question. So having a patient advocate or anybody with you in those settings can be a big help down the road.
Yeah, Barbara, you wanted to ask something?
Yeah, Bridget, how is a health advocate different from a case manager that you would get at a hospital, or is there overlap?
There's certainly overlap. A case manager is the training could be different, and the titles tend to get smushed. I think the key thing to keep in mind, whether you're working with a patient advocate inside the hospital or you've contracted with a person outside of the hospital, is that both a case manager and the patient advocate are employees of the hospital. And that's not to say that they don't want the best outcomes for the patients that they serve, but at the end of the day, their job is to increase the satisfaction of that patient so it reflects well on the hospital. So it's just a little bit of a different approach. A case manager would probably be assigned if there is complex care or being discharged to a different health facility, or there's a lot of different, if there's a traumatic accident where lots of different specialties are involved, a case manager would be the person that's sort of the hub of that system, where a patient advocate can be for any experience that you have in a healthcare setting.
Right. So what are some of the biggest challenges facing patients today, and how can life planners help address that?
Yeah, so there's quite a few challenges. We were talking before about billing and understanding, who is getting charged for what is particularly frustrating, I think, for healthcare consumers and people working in healthcare systems, is that what is charged at, I'm in Westchester, so St. Barnabas is going to be different than what's charged at Lawrence Hospital, which is going to be different than what's charged at, St. John's. And so having very little transparency around what things are, the cost of the things that doctors are doing to you, it's a real challenge. And then whether or not your insurance covers it is even more difficult to navigate, because that changes quite frequently. And what is most frustrating about that situation is that often people are in emergency situations and are getting the care that they need to get, and then 6 months later being hit with a bill that makes them sell their house, or what, that is just astronomical, and they're not in a position to refuse care or to shop around for the best deal. You can't find that information readily. There is some policy work being done now to make cost transparency the norm, but it's not. So the financial aspect and then understanding the financial aspect, I think, are two parts of a monumental challenge. I think where life planners can help with that is helping people really understand their insurance options, supplemental insurance, if they're on Medicare. And a lot of this is just knowing what the right questions to ask or questions to ask. There's no right or wrong questions, but pulling together some information when a person is planning out what sort of insurance scheme they're looking at to make sure that they have their bases covered as much as they can be, which is, it's still a net, rather, it's a safety net, right? There's still places to fall through it. Access to healthcare is going to be a continued challenge. We're seeing record levels of clinicians resigning from the workforce after the pandemic, and record levels of hospitals closing, particularly in the Southeast. So in communities that often need it the most. I don't know what you can do as life planners other than to make your clients aware of where their health facilities are and what type of health facilities they are. So hospitals are tiered in different ways. One is great for trauma. One might be a cardiac hub. And so just again, putting that information in front of a client to say, like, there are different specialties for hospitals. You may want to figure out which one goes where. Again, if you're in the back of an ambulance, they're going to take you to the one that they're going to take you to. But yeah, Bruce, go ahead.
It sounds like that one of the first things life planners should tell their clients when they is get a health advocate to go with you every step of the way.
Yeah, but even if you can't get a health advocate, which again I recommend, but because of the payer situation, that is not possible for everyone, sadly. If they have access to a smartphone, record every hospital or doctor visit, whether or not you share that with anyone or not. It gives you a chance to go back and listen to information. You should always, if it's a planned visit to a doctor, come prepared with a list of questions. I have been helping my mom through a situation right now where she was just diagnosed with psoriatic arthritis, and because the presentation of symptoms was different than what is normal, quote unquote normal, it took 19 months and 5 different doctor groups. And so, we would prepare summaries of, I went to the, dermatological podiatrist and they did these tests. And because your physicians should have access to all of that information on electronic medical records, but anyone that's been to a doctor recently knows they walk in, they look at their computer, they're like, oh, your name is Bridget, right? Like, they're not spending the time to go through all of your past visits. So if you have just a memo that they can see, they'll read it in front of you more than they'll go through your records. This is, again, speaking to that complex healthcare system, which is a challenge that all of us face in navigating care. The more that you can simplify it for yourself and for the people that you are getting care from, they will be grateful to you, and you will be able to have a more productive appointment.
So
go ahead.
How do you advise people to stay up to date with healthcare policies and regulations and incorporate this information into their self-advocacy, or if you're helping someone, a parent, a friend, to stay up to date on what's critical? So
that's a challenge, and back to challenges that health advocates are going to face in the future. They're the same. There's too much information out there. People, whether or not that is health related or otherwise, we are inundated with information. Information is, taking precedence over any sort of knowledge. We're just getting slammed with information. And so being able to sift through what is relevant or useful or not is a skill that unfortunately we will have to continue to develop, but it is tough. So for my advice for staying up to date on policies and regulations is to really focus on the healthcare issues that are most relevant to you. And if you are a person that's doing, community-based advocacy, that could be less about a disease state, but more about inequities in healthcare, and to stay local. So while there is national healthcare work being done every election cycle, and even state level work, which is relevant and important, knowing what your hospital's policies are, any sort of regulatory work being done on a local level is a much easier to manage piece of a very large pie. I recommend getting on newsletters for either professional organizations or disease-based organizations that are relevant to you. They often will do all of that work for you and then send out bulletins. So, the American Medical Association will have different, if you're interested in, I can't think of one thing right now, like gun safety. As a healthcare concern, they will send you a newsletter about different regulations that are happening around that, or if it's about colorectal cancer, so having people that have paid staff to do that work for you is really key. And it's just about narrowing it down so you're not inundated with a lot of information that won't be relevant to your health path.
So in addition to simplifying the history and having that with you as a patient, or if you're helping advocate for someone, having that list and staying up to date on local regulations, that is the hospital regulations, what other strategies do you suggest to individuals or to advocates?
Yeah, I think one is to build a strong care team. Care teams are there to help you, and I think what certainly
could you define a care team?
Yeah, so that could be, if your doctor, if you're going to a nurse practitioner, if then you have a physical therapist, anybody that's sort of helping you manage an issue, or someone that you seek regular care from. It could be a chiropractor, it could be your therapist. And I think we're seeing a little bit of a shift for this, but certainly in white middle class populations, 45 and over, trust in healthcare workers is higher than most any other profession. And what that tends to lead to is, if you are having a negative interaction with a doctor, let's say, you're like, well, that's okay. This person knows what they're doing, but I'm just the patient. Whereas really their job is supposed to help you along this thing. So you can interview doctors, you can make adjustments, certainly talk to a patient advocate or a patient quality specialist if there's egregious concerns, but building a team that will support you if you ever have a more serious issue is important. This goes hand in hand. Ask questions and ask for clarity. I saw there was a question in the chat about is it legal for you to record your doctor's appointment? You can ask your physician if that's okay. It varies state by state on if you need two-party consent, but most physicians will agree to it. Or you can ask them to write down notes for you about what you talked about, and then they can print that out for you. You can. Oh, go ahead.
Sorry. I was just going to finish, and then I'll give a couple of questions that are here in the chat.
Yeah. Well. So you can also ask for clear guidance on what you should be, expectations of what you should be experiencing if you're put on a new medication, and when you should call back. So I always say, at what point should I be feeling better? And they'll say, if you don't feel better in 5 days, 7 days, 10 days, come back here immediately. Or this is usually when side effects come up. If they say, you should be feeling better in 5 days, but if you have extreme nausea, come back. And I would hope they would tell me beforehand, but I don't know. Make yourself a binder. Either it can be an electronic folder of some sort or a physical binder that keeps your records, keeps your notes, have it divided by different issues or different providers, but really being as organized as possible. So if there is an emergency situation, someone can grab that and bring it to the hospital with you. I'm all about advocacy, really learning and practicing how to be a self-advocate is critical in care. And
is there any template out there for health advocates for organizing material?
Yeah, I'll find some and send them to you if you could share them out with the group. But there's also a lot of new apps. This is like a new space that people are doing. The one, I can't think of what it's called. It's a dad who is in tech, son had a chronic medical situation. And by the time this child was 2, he was being seen by 27 different physicians. And so the father said every time we would go to a new appointment, we would waste all of this time saying and then we went to this place and then we went to this place. And so he created an app where he can share all of the information ahead of time to the different members of the care team. So there's a lot of innovations to keep yourself organized, but like a 3-ring binder never fails. Yeah.
So I want to be sure to save time to come back to Betsy's excellent question on the curriculum, but let's do that last. Let's address Kendall's question. If a patient were to hire a health advocate to accompany her to an outpatient appointment, how much could that cost? Is there an average?
It's tough to say. It depends on, where you're living and the density of health advocates. And again, some insurance might cover some of that, but it's really anywhere from maybe $70 to $300. And I think that depends on how complex the care is. If you're just going to your annual checkup and you want someone to be there with you, probably lower. One second. Hi, yes? Sorry, I'm alone in my office building and security keeps coming to check if anyone's here. So it really just depends on where you are and what sort of access to patient advocates you have.
So how do you collaborate with other organizations or stakeholders in your health advocacy work, and what strategies have you found useful in building partnerships in health advocacy?
Yeah, so I try to think as broadly as possible. I certainly want to partner with sort of disease state specialties, so your ovarian cancer networks or certainly caregiver networks. There's a lot of room for overlap there. When thinking about sort of community level or system level change, because health touches every aspect of our lives, there's a lot of places to be creative in collaboration. And so I've been working with a organization of pro bono lawyers that do justice work and reentry, helping people re-enter the world. And so partnering with them so that the people that they're working with have some level of health literacy and can then start advocating for themselves.
People who've been incarcerated,
yeah.
And that must be a giant challenge, I would guess, that people have been incarcerated getting proper health care.
Yeah, both inside and outside of incarceration. And that was another issue we saw with COVID, was high numbers of incarcerated people dying from the disease. And now the prison population after the war on drugs is older, right? So there's people that have all of the care needs that people in their 70s, 80s, and 90s have, but they're incarcerated. And so what does that look like? How can people advocate for their care when they don't have access to the same systems that we do? And so again, it's about finding common challenges that are better addressed collaboratively, and how we can leverage our resources to help to make as much impact as we can. And if you're looking to do any sort of collaboration work, my best advice is to really research the values of the organization and see if your values align with that and how they align with that, because it's not beneficial to anybody if you're doing work in similar spaces, but for very different reasons.
Great. So 2 last questions, then we'll just open it up to anybody. One would be, what do you see as the future of health advocacy, and how can we as life planners help shape that future? And then we'll then turn to Betsy's question on the curriculum.
Yeah. It's like, I have a plant in the audience. I appreciate it. Yeah. So I think the future of health advocacy will really be much more holistic than it is now. I think as a society, we are thinking about health in a more holistic way. So including mental health when we talk about health, including sort of the healthiness of your life rather than just your body. I think there's a lot of room for health advocates in the future. And as we're, facing climate collapse and a host of socio-political issues, it'll be more important to build these collaborations, because so much of that will impact the health of individuals and communities. Life planners, I think, can be a really great resource for people in pushing their own health forward, and then the future of health advocacy. But you're in a position to collaborate with healthcare professionals to really maybe develop some tools that can be widely spread to your particular constituency. And as people that are connected to different groups and individuals and across the country, you have a voice in advocating for policies that impact your clients, whether that is locally or nationally, and whether that is, a quote unquote health issue like a Medicare reimbursement scheme, or if that is something that's really passionate to you, or that you or your clients are passionate about, that impacts health, if that's like gun safety or, climate responsibility, any of those aspects.
Great. So if you'll just talk a little about the curriculum at Sarah Lawrence, and then we'll just field whatever questions people have, for as long as people are willing to hang out.
Yeah, sure. So we actually offer a Master of Arts in Health Advocacy and advanced certificates. So those are graduate level mini certificates. They're each 4 courses. And the curriculum is, as Bruce mentioned, multidisciplinary. So students will learn about the economics, the legal, the policy, and the historical context that shift health, that have shaped healthcare to be what it is right now. And so really giving people an understanding of the innate challenges to the system, why it is designed the way that it is, and being able to envision a different way by doing comparative studies to different governments. We spend a lot of time in Switzerland and Cuba, different models for delivering care. While that is happening, there's also a real practical track. And so looking at how to design advocacy campaigns, to build programs, having the research and community needs assessment and community engagement in all of that work. And in the master's program, it finishes with a field work requirement to students spend 300 hours in the field doing advocacy work in really varied settings. So we've had people do, a needs assessment of youth transitioning out of foster care. We've had people do work in refugee communities, getting those people access to care. Again, as I said, there's so much work to be done that people can really take a path that is most passionate to or that speaks most passionately to their values and interests.
Well, I bet every person on this call has been called upon to be a health advocate for someone that they love.
I'm sure.
Just looking at the faces. And everyone has probably faced some frustrations and have a bank of questions to ask. And so go for it. Anybody want to open up their mic or raise their hand? Questions? I mean, I know every one of you have had challenges of different kinds. So, Barb?
I put this in the chat. So if I want to do a search for a client or help a client do a search for a healthcare advocate, what are the different titles to look for? And can you say, is there a difference between a geriatric care manager that I think would also be a health advocate?
Yeah.
Population. So even starting with how do you search?
So I would recommend, I can put these links in the chat. There are two professional organizations. So pause there. Patient advocates, there's a board certification for that role. And so the organizations that run that certification test have a database of people that are available. There's also a professional organization that patient advocates join that also have, a directory. And so those would be the first two places that I look. It's called, I will find it. What is a problem in the healthcare field is that everyone loves an acronym, and there are so many that overlap with each other. But I know one is Health Advocate X, the letter X, and then it's APHA, which is the Patient Health Advocate. It's confusing because that's also the American Public Health Association. So either one of those two. I would imagine that there are geriatric case managers that are certified in patient advocacy, and you don't need the certification to be useful in any means. I would imagine that the geriatric case managers, that's their specialty, and so would be a great resource for people.
So I see a bunch of questions in here. Paula, you have some, and so why don't you go ahead and open up your mic and ask your own question?
What qualities or qualifications would you want to look for in a healthcare advocate other than the certification? I mean, is it important that someone have a health background?
No, yeah, I think the certification is probably your best particular quality to look for. The people that have come through our program, some have been, clinical nurses for 25 years. We have a lot of social workers that do that. Or then we have people who just have a lived experience. So someone coming into our, August cohort, daughter is on the autism spectrum. She's been advocating for this person for now 25 years. The daughter is an adult, she's on her own, and this woman's like, I have the skills to do this. I want to do it for other people. And so the background is less important. That's why I think that certification is a great place to start looking, because it'll pull everybody together.
Is it how to put it, a stringent enough certification that you can trust that someone who has it has good skills?
Yes, I think that it is a good benchmark for people. And it's also not a very well-known field And so people who go through training and then do the certification are usually there for the right reasons. It's not something that people tend to do to make money or be on they would have had to sought it out to do it.
So if I can take another minute. So one of the things I experienced when I was helping my mother in her later years is the concern that if she went into a nursing home, which thank God she didn't need it, but there's no choice but to have the nursing home doctor be your doctor.
Right.
And I was concerned about the conflict of interest for someone who is essentially hired by a facility and you're making health decisions for you. I mean, I know people are over-medicated for one thing. What choices does one have if it gets to that, to have some sort of advocate? I see the doctors in nursing homes as being incumbent to the management there, even more than the patients. And it worries me that, how does someone have a fair assessment in that situation?
Yeah, that's tricky, and certainly not the first time I've had that concern or heard that concern and have had experience with that as well. It's just, there's no clear path forward. You certainly can take a person to see another physician. It can then cause trouble with insurance if, the physician on file is the one at the nursing home. And so there's some barriers there. I think a health advocate could be really useful in that, again, advocating for the patient's concerns. It could also be one of the great things that came out of the pandemic, that's a weird thing to say, is the increase in telemedicine. And so you could have a physician do a Zoom call just to see if everything seems okay, or to review the medical.
Say a doctor of your own questioned the medications you were getting. What rights do you have in the nursing home to question what their doctor? I mean, do you have any right whatsoever to question they're officially your doctor?
You do. You absolutely do. You're not a ward of the nursing home, right? They don't have legal. They're not your legal proxy.
So you're not signing something over saying that you're.
I would be surprised if that was included in the paperwork. I think a lot of it is just, sadly, many people in nursing homes don't have anybody that are checking in with them. And so they're just trying to get through the day. I think there's probably more hesitation around not wanting to upset the doctor, or if the doctor isn't the one that's providing care, are the people that are administering the drugs responding to this outside directive. So it's a muddy situation. There are certainly lawyers that focus on nursing home policies, and so that could be an avenue to explore more. This is the limit of my knowledge in that area, but I would be surprised if there's any sort of sign over of rights.
Joyce, thank you, Paula, for the questions. Joyce and then Joan.
Yeah, can a patient advocate help an individual get different, if you're dealing with a number of different doctors, to get them to collaborate?
So yes, I mean, that is one of the roles of a health advocate, is to be that hub. And so it could, having all of that information, being able to share it out to other people, and then just requesting, can we set up a call between the 3, 4, 5 of us, however many. That's a really critical role that a health advocate can play, is getting that.
Do you think doctors are more likely to listen to a request from a health advocate for that kind of collaboration than they would be willing to listen to an ordinary.
Yeah, I think there's probably some of that. I should say, I often feel like I'm demonizing doctors. Doctors often are there to do the right thing, and they're just, allowed to spend 6 minutes with a patient. And it's not the career I think people thought that they would have when they wanted to be doctors. A patient also could ask for it. I think it is less likely that a patient wishes for something if the doctor is resistant to it, or feels like they could get some sort of retaliation or not be able to interact with the doctor in the same way. And so having a patient advocate do that might feel safer for folks. I think oftentimes a health advocate is asking a doctor to do something that they want to do, but it is just not part of what they have been told to do. And so again, it's about asking the right question.
So you may be giving a doctor leverage to do something that he would like to do, but the hospital policy may frown upon in some way. But with knowing that a health advocate's involved, the administration might be more willing to accept the doctor's decision to do something.
Mm-hmm, mm-hmm.
That's fascinating. Other questions?
I mean, I think it's terrifically inspiring. I worked on this project, Our Bodies Ourselves. So I've been
excellent. Yeah.
For years.
Joan was one of the original authors.
I was the founder.
Wow, that's amazing.
Founder.
So I just feel it's wonderful, the work that you're doing. I mean, it's really terrific. And the healthcare system is so complicated to navigate. Just also want to say that one of the generic things is that it's also, in terms of education, so focused on disease rather than prevention.
Yeah.
And there needs to be so much more preventative healthcare, for people. And the idea that people just need to be their own advocate and really not assume that there are answers out there, but they really have to keep those notebooks, keep those notes, really be able to advocate and be informed about it. And also just we have a website, and you've raised my consciousness because I'm going to, just check it and see if all this patient advocacy is so important, because my God, it's a very needed field, and it's wonderful that you're doing all this.
Just with our bodies, ourselves, yes, knowing like you are the expert of your body, and and I think there is a change now in medical training that is legitimate.
Well, certainly women's healthcare needs has gotten improved. Yeah.
Yeah, and but if you think about
that wasn't hard to do, was it?
There's still places where you can have non-consensual pap smears if you're and so there's still so much work if you are undergoing a medical procedure where you're under anesthesia. Medical students are often allowed to practice on your body in certain places. And so there's still so much that feels like what? And so there's really a lot of room to do any sort of work. Yes. Mm-hmm.
Meg, did you have another question? You're muted. My favorite words. I have it on a sampler over my desk.
It's a broad picture comment. I also agree that this is very important work. I think it's a very sad commentary on our system that it's.
Yeah,
absolutely.
And I really, my ears perked up when you said something about you thought the field was becoming more holistic. And somebody mentioned also prevention as opposed to, I just think our whole system needs to reevaluate health. And I personally am interested in integrative medicine. And I wonder if you had, if your advocates are trained to deal with integrative medicine. Okay.
Yeah, absolutely. And again, it's sort of like where they choose to go. But I think the people that come through this program are more open to that sort of whole health model in a way that if you went through a medical school, you would not. But part of the issue is medical information has so quickly changed that the people that are teaching it are not always up to date. They don't have the space in their schedules to do a lit review on all of this new information. But then that leads to a lot of dismissal of things that now have evidence behind them, like, integrative medicine were really harmful. There's ongoing work right now about like pain management for people of color, because for years, medical students were taught that people of color experience less pain than white people, and that is still being taught in some schools. And so it's like, well, yeah, like we can give access to people, but if system is ingrained like this. And so I do think having young people, I see the young generations being more proactive for their elders. I do think that this younger generation, having seen COVID, not being able to visit grandparents, seeing what happened, the decimation of nursing homes, that there is, and a real embracing of mental health as health. I do think that there is a bit of a sea change happening now in how that younger generation is thinking and talking and wanting to be educated in health.
I often feel like we're at a state in the healthcare system that is so hopeless that it's so great. I'm so grateful to hear Bridget speak and to remind us that there are things we can do. I will share two quick stories. One was Leslie, my partner, was at the doctor's last week to get a checkup. And while she was there, she noticed people more than usual scurrying in and scurrying out. And she didn't know what was going on. She went up to the desk and said, "Is something happening?" And they said, "Well, Compass Medical just announced they're closed in all offices. We've all been fired as of a few minutes ago."
Oh my God.
There were no instructions given to patients of what they should do, how they should do it. And Leslie was seen while she was waiting there, Leslie started dialing my doctor to see if she'd get on a waiting list. She couldn't get on a waiting list because there are no doctors available. So she's actually on a waiting list for a new doctor coming into the practice. But she was smart enough that she started dialing for records and things like that. But Compass literally just dismissed any concerns overnight in Massachusetts last week. It's insane.
Amazing.
And the other story, I think I told Bridget this story. I have a friend who's a cardiologist who called me up one day and asked me to come over to the hospital where he works in Brockton. And he showed me how people were, the day before he had been at the emergency room, and a friend of his doctor pointed out a patient, someone who was in the waiting room, who had been waiting for several hours, and an older man. And the doctor had gone over and said to the older man, "Can I help you? What are you waiting for?" He said, "My wife was taken into the ER about 3 hours ago, and I haven't heard anything." So he said, "What? Describe your wife to me. I'll go in and I'll look." He did. The doctor went in and he found the woman dead on a gurney in the hallway.
Oh my God.
So my friend who's a doctor called me the next day and said, "I want you to come over here. I want you to think about how you can help getting some press for this." He showed me, they can now see, all doctors have the ability to see what's happening in the emergency room. And they could see, he showed me people who were waiting 8, 7, 10 hours for very common things in the emergency room. It's insane. And I just think like there's something that can be done and has to be done. But, so hearing Bridget talk about the potentials of Health Advocacy gives me some hope, but it just feels sometimes hopeless at the moment. Sorry to bring that.
Oh no, I'm gonna. There's a documentary called Code Black, and it was filmed while I was working at the with this union, and it's about an emergency department at LAC USC, and about the lives of these 22-year-olds or 25-year-olds and it is grueling. What they are dealing with is grueling. What they go through is grueling, but they are also so hopeful and trying to set up a better system for people. And so it is, I think, worth watching to get that, because unfortunately your friend's experience is not uncommon, especially in the last 2 years where there's just fewer hospitals, fewer physicians, and many, many more patients in critical need.
Yeah, well, before we let you go, I want to say how grateful we are for all your information today and for giving us a view into the health advocacy world.
Thank you for the opportunity. It was great questions. Thank you.